Question number 94, page 2 on today's order paper. And the question stands the name of a member for Central Tongue, Honorable Alexander Roosevelt Otuji. Honorable member, if you are around, you may.
Mr. Speaker, may I have his authority to seek your leave to ask the question. He's not well.
Very well.
Mr. Speaker, I rise to ask the Minister for Health what plans the ministry has for the refurbishment of the dilapidated health infrastructure of the district hospital at Adidome. Thank you.
Yes, Honorable Minister, hold on a bit. Honorable Majority Whip, any issue?
Speaker, if you may indulge me, I see an urgent question also directed to the Minister of Health, and that is B5B. It's related to the Minister of Health, and I thought we could take that one first before we take the other ones.
Yes, very well. So that question stands the name of a member for Kita, Honorable Kwame Jodulu Gapi. Honorable member, you may ask your question.
Thank you very much, Honorable Speaker. I rise to ask the Minister for Health what urgent steps are being taken to address the highly contagious COVID-19 Delta variant that have been detected in the country. Thank you.
Yes, Honorable Minister.
Thank you, Mr. Speaker. Mr. Speaker, the Delta variant is one of many variants of SARS-CoV-2, the virus that causes COVID-19. Other key variants are the Alpha, Beta, and Gamma. The Delta variant of the SARS-CoV-2 was first detected in Ghana in May 2021 when a random sample of COVID-19 positive samples were taken through genomic sequencing. Genomic sequencing has been the key component of Ghana's response to the COVID-19 pandemic. In July 2021, we further confirmed the circulation of the Delta variant within the Ghanaian population. The Delta variant is known to be more infectious and hence likely to result in an increase in the number of cases in general and severe and critical cases as a consequence. The increase in cases of severe illness relates more to the high infectivity of the variant. As a ministry, the measures in place for preventing the face mask use, wearing the face mask at all times when in public, hand hygiene, effective hand washing or the use of an alcohol-based hand sanitizer, and maintaining social distancing. To this end, we are strengthening all our existing measures as follows. Risk communication and social mobilization for COVID-19. Mobilization of opinion leaders, religious leaders, traditional leaders, key influencers, etc. Putting in place contextualized risk communication messages for locations such as schools, workplaces, etc. Establish and enforce adherence to COVID-19 safety protocols where appropriate. Surveillance. Strengthening contact tracing, quarantine, and isolation. Strengthening surveillance at all points of entry, including landing beaches. Laboratory. Scaling up of the testing capacity for COVID-19. Case management. Continuous strengthening of the capacity for case management, including oxygen supply. Public education on the need to visit health facilities when unwell for testing and appropriate treatment. Vaccination. Increasing its capacity to handle different brands of vaccines, including for those that require ultra-cold storage facilities. Revision of the vaccine deployment plan in line with current COVID-19 situation, that is prioritizing hotspots, regions or districts, highly populated areas, and at-risk groups, persons 60 years and above, and those with underlying medical conditions. Thank you, Mr. Speaker.
Yes, Honorable Member for Ita, any supplementary question?
Thank you very much, Honorable Speaker. Honorable Speaker, in fact, research has shown that the Delta variant is about 50% more contagious than Alpha variant And then Alpha variant also itself is 50% more contagious than the original coronavirus. And the spread of this highly contagious Delta variant COVID-19 is causing infection and hospitalization to rise again in the country. Based on the answer provided by the Honorable Minister, I would like to know, in terms of surveillance, what kind of surveillance are they doing? Is it passive or active surveillance are they doing? Strengthening contact tracing, why is it happening? And which areas is it happening? I would like to know from the Honorable Minister.
Yes, Honorable Minister.
Honorable Speaker, contact tracing is ongoing across the country, especially in Accra and Kumasi. When we find a positive person, we do the same thing as we were doing in the past and try to see where he has contacted, and we try to do mop-up and ramping up to actually test people. Thank you, Mr. Speaker.
Yes, Honorable Member, any further question?
You, Honorable Speaker. Under the laboratory, the Honorable Minister make mention scaling up of testing capacity for COVID-19. I would like to know where are we now and where are we going, because there is no data supporting this. Thank you.
Yes, Honorable Minister.
The Speaker, when we got the first case of COVID in March 2020, we had only 2 testing centers in the country, Noguchi and KCCR. Mr. Speaker, as I speak, we have 43 different sites that belong to the state where people can test across the country. Almost all regional hospitals and a number of these hospitals now have PCR test kits that they are using. Again, we have licensed private facilities that are also doing some tests, especially in Accra and Kumasi. So we indeed have actually expanded our testing capacity. Thank you, Mr. Speaker.
Honorable Member, your last supplementary question.
Thank you, Honorable Speaker. I also further request from the Honorable Minister. In the entry point, or in the answer he provided, entry points where they are doing testing, and Ghana Airport is Kotoka International Airport is one of the entry points that they are doing testing. I would like to find from the Honorable Minister how many companies are doing testing in the airport, Kotoka International Airport, and why infants are also being charged $150.
Honorable Minister, no. It's unrelated to the actual question. So I'm not admitting this particular question.
He mentioned entry points in the answer. Honorable Speaker, he mentioned testing is happening in the entry point, and airport happened to be one of the entry points. That is why I'm promised my answer on that. He provided this answer, not me. The ministry provided that answer. It is clearly here.
On
scaling up testing capacity at COVID-19 and entry points is there. Sami, strengthening the all points of entry, including landing beaches. I'm not the one who's saying it.
Mr. Speaker, you've given a directive, and I thought the member would take a cue. The orders provide in Order 69. As soon as the question is answered in the House, any member beginning with the member who asked the question may, without notice, ask a supplementary question for further elucidation on any matter of fact regarding which the answer has been given. But a supplementary question, listen to that, a supplementary question must not be used to introduce a matter not included in the original question. It's not the answer. You are quoting the answer. It should not be included, it should not go outside the original question. That is what our orders provide. Don't litigate the matter with the Speaker. The Speaker has given you a directive.
yes, Minority Deputy Leader.
The Speaker, what the leader read is correct. But the answer given by the minister, the member will ask supplementary question based on the answer provided. And that is exactly what the member is doing. That he mentioned testing sites. So he is asking question based on the testing site. So members should be allowed.
Yes, minority deputy leader, respectfully, my ruling has already been taken. My friend, sorry, let's move on. So we move to question number 94 on today's order paper, which stands the name of Central Tongue. So my brother, you may ask the question on his behalf.
Mr. Speaker, I stand on my earlier submission to you to ask the question and to ask the Minister for Health what plans the ministry has for the refurbishment of the dilapidated health infrastructure of the district hospital at Adidome. I thank you.
Yes, Honorable Minister.
Thank you, Mr. Speaker. Mr. Speaker, currently the Adidome District Hospital has not been captured in our 2021 plans and budget for any current refurbishment. We will, however, do an assessment based on the request and evaluate it for consideration budget in the ensuing year's budget. Our ability, yes. Mr. Speaker, indeed, yes. I have the authority to so do. Mr. Speaker,
Very well.
my simplest supplementary question is, the Minister says to the House that pursuant to this question, it will take steps to capture it for future program. Would that happen this year?
Minister, will that happen this year?
Mr. Speaker, it can only happen this on availability of funding. Thank you, Mr. Speaker.
Yes.
Mr. Speaker, that would be all for.
Very well. Thank you very much. So we move to question number 95. That stands the name of a member for Kintampo North, Honorable Joseph Kwame Kuma. Honorable, if you are around, you may ask your question.
Thank you, Mr. Speaker. Mr. Speaker, thank you for the opportunity to ask the Minister for Health if there are plans to upgrade the Kintampo Municipal Hospital to a teaching hospital.
Yes, Mr. Honorable Minister.
Thank you, Mr. Speaker. Mr. Speaker, there has been discussions with regards to upgrading the Kintampo Municipal Hospital to a teaching hospital. A committee has been set up to come out with the modalities towards the upgrade of the Kintampo Municipal Hospital to a teaching hospital. Mr. Speaker, we will update the House when the committee presents its report and roadmap towards the proposed implementation. Thank you, Mr. Speaker.
Yes, Honorable Member.
Kintampo Municipal Hospital, because of the situation where it is situated in the nation. I want to ask if the committee so set up to help the time frame within which they will be finishing with their report. Thank you.
Yes, Honorable Minister.
Mr. Speaker, the committee is actually working, and we are expecting to receive their report in the next 2 months. Thank you, Mr. Speaker.
Yes, Honorable Member, any further question?
Thank you, Mr. Speaker. I want to ask that Kintampo Municipal Hospital is always overwhelmed when it comes to the accident cases along that stretch. Is the minister, by way of reference, thinking of an interim accident emergency plan for the hospital till the main hospital is built is considered in future?
Yes, Minister.
Mr. Speaker, we haven't had any plans towards that. Until we receive the report, we wouldn't know exactly what to put in there. So we will, based on the recommendations from the report, that is what to determine the next roadmap, and that is what we will use to try to resolve the situation my colleague is talking about. Thank you, Mr. Speaker.
Very well.
I'm grateful, Mr. Speaker.
Thank you too.
Honorable Minister.
Yes, we move to question number 108, page 3. That stands the name of a member for German North, Frederick Yao Ahinkwa. Yes, honorable member.
Thank you, Mr. Speaker, for the opportunity to ask the Minister for Health when actual construction of a 60-bed facility commenced at the Sampa Government Hospital, as captured in both the 2009 and 2020 budget statement and economic policy of government, will be completed.
Yes, honorable minister.
Yeah, 2019. Okay.
Mr. Speaker, I wish to state that the construction of the 60-bed facility was earmarked. The project planning and implementation arrangements will start towards the smooth implementation of the project. Thank you, Mr. Speaker.
Yes, honorable member, any supplementary question?
Thank you, Mr. Speaker. I want to ask the minister, is there any timeline for the exploration of the new source of funding for the project?
Minister, any timelines?
Minister, we don't have timelines. I'm only relying on the budgetary allocations and how Minister of Finance will allocate funding for us. Thank you, Mr. Speaker.
Very well. You have, okay, good.
Yes. Thank you, Mr. Speaker. This project is dear to the heart of my constituents. So I want an assurance from the minister whether the project will see the light of the day. Thank you.
Minister, no, don't answer the question. No. That whether the project will see the light of the day. Oh. Anyway, Minister, you.
Mr. Speaker, I don't think I can give an assurance. But I will want to state the fact that I come from that area as well. Kintampo Hospital was one of the areas I visited first when I became Minister for Health. I was instrumental in trying to get it scheduled for the Sano Hydro funding. Unfortunately, it couldn't materialize. And we are looking for funding. I can't assure, but any time that funding is available, we'll try and rehabilitate Kintampo Hospital. Thank you, Mr. Speaker.
Very well. Honorable members, we move to question number 109, page 3 on today's paper, other paper. That stands the name of Shai Osudoku, Member of Parliament, Honorable Linda Ohinewa Akwele Okulu. Honorable.
Obenewa, sorry, Mr. Speaker.
Obenewa
Yes.
Akwele Okulu. Honorable Member.
Most grateful, Right Honorable Speaker. I rise to ask the Minister for Health if there are plans to build Chiefs compound in the following communities in the Shai Osudoku constituency to provide access to health care. Lubuse, Gigedokun.
Mr. Speaker, currently the areas listed in the question have not been captured in our 2021 plans and budgets for any construction of Chiefs compounds. We will, however, do an assessment based on the requests and evaluate them individually for consideration budgeting in the ensuing year's budgets. Our ability to implement this, again, will largely depend on the quantum of budgetary allocation to the ministry in subsequent years. Thank you, Mr. Speaker.
Yes, Honorable Obenewa, any further?
Thank you, Mr. Speaker. Let me commend the Minister for his response. But from the Minister's answer to my question, he indicated that this communities listed has not been captured in the 2021 budgetary allocation for Chiefs compound, meaning there are no future plans for this community. I want to find out from the Minister, when will the communities be captured to enable them to access to quality health care? Thank you.
Honorable Minister, when will these communities be captured?
Mr. Speaker, I just said I will do an assessment. We have a policy in capturing chief compounds. What we plan to do is the fact that every electoral area should have at least one chief compound. And when I talk, my colleague has mentioned. So not until after assessment, it will be difficult for me to even begin to tell time and things like that. Thank you, Mr. Speaker.
Yes, honorable member.
Thank you, Mr. Speaker. Inadequate funds is a major challenge to the healthcare facilities. I want to find out from the minister whether, apart from the budgetary allocation, is there other avenues that can be considered? Thank you.
Yes, Minister.
Honorable Speaker, apart from budgetary allocation, GOG funding, we might only be lucky to see a philanthropist who donates for us to come and put a chip compound there. Or through communities initiative, the ministry can support again with budgetary allocations. So apart from these, the other sources are borrowing for bigger, large ones, not definitely chip compounds. So rely on budgetary allocations, which includes some part of the oil money, the alpha allocations we have. These are the sources of funding we can utilize to do chip compounds in the area. Thank you, Mr. Speaker.
Yes, Honorable Obinowa.
Thank you. I want to ensure this, I want to kindly find out from the minister if he can ensure these communities are duly captured in the 2022 budget with adequate funds. Thank you.
Yes, Honorable Minister, being reminded of universal coverage.
Honorable Speaker, we are very mindful of universal health coverage. And we try to make sure that we have facilities closer to people, affordable access, and what have you. Our assessment remained, I said earlier, distances from existing facilities. The villages we are talking about may be very close to even some facilities elsewhere. Going around the country, you can have two towns very close to each other. Immediately one chip compound gets to one, the other side wants it. Like my colleague in Weta and the environs. They want hospitals in all the towns around, quite well, you know. So we take cognizance of these, and after our assessment, my sister, we will look at what we can do for you. We are very mindful of getting universal health coverage, but we now have facilities that can cater for a lot of people, and with Agenda 111 soon coming on board, I believe even if you don't get a chip compound, you might get this hospital closer to where you live. Thank you, Mr. Speaker.
Minister, was your reference an invitation to the leader to also ask a question?
Honorable Speaker, please no, please no, please no. Honorable Speaker, I withdraw, please no.
Mr. Speaker, thank you very much. He mentioned my name or make reference to me, but I won't ask questions based on that. But, Mr. Speaker, can the minister consider a loan facility that can take care of a number of chip compounds? For instance, for one district hospital, you don't need less than $20 million, more than that. But that possible chip compound will be provided in our electoral areas.
Yes, Minister, will you consider a facility for chip compounds?
Honorable Chair, that is considerable, but Parliament approves these facilities for us to use. So if after we hitting 72% debt GDP ratio, if the House will also consider still adding on to our debts, the minister will willingly consider using the facility for chip compounds.
Leader, I gave you that opportunity.
Mr. Speaker, it looks like the minister
is supposed to answer so many questions.
Minister, a greater population. That is the impulse of my question. It's not about adding on, but who to borrow again? You'll be borrowing.
Very well. We move to question number 110, which stands in the name of Honorable Adama Suleimana, a member for Tain. Honorable. may ask your question.
Thank you, Right Honorable Speaker. But to state that my constituency is time. Thank you. I rise to ask the Minister for Health.
So, T-A-I-N.
Yes.
It's pronounced time.
Time.
Not
Yes.
T.
Not T.
Okay, good. Good.
Yes.
Go on.
Honorable Speaker, our records show that the administration block of the Sekwane Samed Refit Training College was awarded and implemented in 2016 at the Bono Ahafo Regional Coordinating Council with funding by Get Fund. Further checks also revealed that the project has been suspended due to erratic flow of funds. The Ministry will liaise with the college to assess the level of completion and ascertain how much is required to complete and liaise with the Get Fund and the Bono Regional Coordinating Council to see to the completion of the project. Thank you, Mr. Speaker.